Could someone have chest pain associated with TMD? Could that be actually something that could occur? So I went back to my anatomy books, Gray's Anatomy, went back to my experience in cell biology. I already knew the actual pathophysiology, which is when this joint becomes damaged, it becomes inflamed. If it doesn't heal properly within a reasonable amount of time, the inflammation changes characteristics into chronic inflammation, which is a little different cellular characteristics, chronic inflammation. When that occurs, that signals the brain, lower levels of the brain, amygdala and brainstem. This joint is damaged, it's inflamed. The brain then signals the muscles that move this joint to tighten up. And that is why one of the most common symptoms is jaw pain or facial pain, where the muscles of mastication and the muscles of mastication are attached here, as you know, temporalis, masseter at the zygoma, masseter at the inferior border of the mandible, mylohyoid underneath the mandible, internal and external pterygoids, not over the joint, but in front of the joint. And that's where, and even across here, masseter can insert in the zygoma forward and pull on the bone. And wherever those muscles of mastication pull on the bone is where it hurts, because that's where the nociceptors on the periosteum are stimulated, which go back to the brain as a sensation of pain. So you have a brain indicating and sending signals to the muscles of mastication that says, I'm inflamed, I'm damaged. The brain says, don't move the jaw joint, don't move the joint, tighten up, hold the jaw joint still to help it heal. That is the pathophysiology. But it goes further than that, because when the joint doesn't heal, you keep bruxing. Bruxing is associated certainly with TMD. One of the three causes of TMD is bruxism, acute trauma, and functional malocclusion. All of those damage the joint. But however the joint is damaged, it becomes inflamed, sends signals to the brain. Brain says, I'll help you out, don't move the jaw joint. But when it does not heal and you continue to brux, brain keeps getting the signals. I'm inflamed, I'm damaged. The brain says, I told you, hold the muscles of mastication, facial muscles tight. Now hold the whole head tight, tighten up, don't move. And that's why neck pain is the second most common symptom of TMD. The second most common symptom of TMD is neck pain. But it goes further than that.